CCNE Accreditation is the obvious way for a nurse residency program to evaluate how they are performing, but also to recognize opportunities for improvement.
As the leader of a nurse residency program, you are on the cutting edge of professional development in nursing. The Institute of Medicine has recommended nurse residency programs as an important component of developing nurses in the workforce, and you have invested in establishing one. How do you build on and grow your investment?
CCNE is the leader in nurse residency program accreditation. They were the first accrediting organization to have standards for nurse residency programs, and the standards are meaningful.
We've had a nurse residency program for a number of years at the University of Kentucky, and once the availability of accreditation was there, our leader said we can validate that our nurse residency program meets the essential standards that have been set forth by CCNE, and it will be a very good draw for prospective students who want to attain positions here after graduation.
When CCNE was founded in 1996 as the autonomous accrediting arm of the American Association of Colleges of Nursing, steering committee members developed a set of values to guide the accreditation process.
The values of self-assessment and continuous quality improvement are not something you do one day and then you don't continue to improve, and CCNE has instilled that, and I believe that programs are better for that.
The self-assessment is very comprehensive. It goes through the entire program, the faculty, the residents, the site, and to have someone come and take a look at you through very objective eyes can be intimidating, but it's actually great growth.
It isn't a gotcha. It's a how do you help schools, how do you help residency programs be the very best that they can be.
It recognizes the valuable contributions your organization is making.
Standards really recognize the importance of an academic and service partnership and look at how the academic side and the service side can work together to improve the development of the resident during that first year of nursing.
How does choosing CCNE as your accrediting agency benefit your program? 100% of program officials rated the CCNE standards as valid indicators for judging the quality of a nurse residency program. And 100% rated the self-study process as beneficial to their constituents, such as residents, educators, faculty, and administration.
I think that accreditation has actually strengthened our nurse residency program. As we have matured as a nurse residency program, we have seen fabulous programs from our students. They are actually looking at ways to reduce CAUTI in trauma patients. CCNE accreditation is about making sure that we meet essential standards, but when you take that down to a very granular level, it's about ensuring that patient care is as good as it can be.
We have applications from across the country because of the CCNE accreditation. So we have people coming specifically for the residency, but also specifically to take care of the veteran population in a residency program.
With CCNE, we have a packaged set of standards that a residency program can follow to deliver a high-quality nurse residency program.
They're clear, but they're also open to interpretation of the different sites. It doesn't feel like a cookie-cutter design. As someone who's gone through the CCNE accreditation process as a nurse residency program, I think it is the obvious choice of an organization to accredit your program. They truly understand the needs of the new graduate nurses and are there to support you through the process, but they're also very fair in their evaluation terms and very consistent in the standards that we're evaluated on.
CCNE has stayed on top of the future of nursing. Their focus on baccalaureate and higher really speaks to the IOM competencies for the future of nursing.
When the IOM report came out and really strongly urged everybody to have a transition to practice program, we were committed to doing that. CCNE provided us with standards to help us to do that.
Our program is the only one in the Kansas City metropolitan area with CCNE accreditation, and it gives us the opportunity to tell everyone that our program is different. It's strong. It's great.
For more information about CCNE accreditation, visit www.ccneaccreditation.org or call 202-887-6791.